Hi, my name is Dr. Mark Burdorf. I'm a board-certified chiropractic neurologist in Scottsdale, Arizona. If you've been following me in my posts recently, I'm always talking about right eye software, or I'm talking about focus builder. And what I do is we do functional neurology here, so I want to kind of explain really what these therapies are. So I use something called right eye software because it measures eye movements, and there's three basic eye movements. First is called a pursuit. Another is called a saccade, the last is a fixation. So what pursuits are is when you follow a target with your eyes, and that's a slower movement. When you follow a target and go back to the next target, that's a saccade, which is more reflexogenic. Now, there's a part of your brain called the parietal cortex, that's pursuits. There's a part of your brain called the frontal lobe, and that's more saccades. And then there's a back part of your brain called the cerebellum that basically works with your frontal lobe to fixate on an object, okay? Now, parietal lobe has to do with more pain and suffering, sensory motor. Frontal lobe has more to do with behavioral stuff, and the cerebellum has a lot to do with balance, okay? And why is this stuff so important? Well, if you go ahead and take a hand, cup the back of your neck nice and firm, and if you follow your thumb with your eyes back and forth quickly, do any of you feel your neck muscles move? Well, I do. And if you don't feel your neck muscles move, that's bad, okay? Because we know brain is sensory motor, and the three things that actually affect balance as well as tone of your muscles is your eyes, your vestibular system, your cerebellum. Now, it's not a bad idea to go to the gym and do back exercises, but truly the muscles that hold your spine together are the size of your fingers, okay? And they're all under the control of these three structures. So eyes is a visual pathway. Your inner ear is called your vestibulum. There's horizontal, anterior, and posterior canals. And then again, our friend the cerebellum, even though it's only 10% volume of the brain, it's got over 80% of the neurons. So why is this stuff so important? Well, if you injure your neck in a concussion or a whiplash, what's going to happen is these muscles tend to atrophy. And we know that basically if you do eye exercises, they coordinate with your deep intrinsic neck muscles. So what you're seeing here right now is I'm doing a diagonal microsaccade exercise, and the patient is doing a pursuit back up to the left, and then he's going to work his way back down to the right. And that exercise there is specific for strengthening your neck and back muscles. So I hope you learned something today, and here's what we do is we use the right eye software to determine what is not working right. Are your pursuits, are your saccades, are your fixations not working correctly? And the cool thing is if they're not, we can assess you, give you an exercise, and then reassess you in maybe 7 to 10 days. So if you want to learn more about my practice, just follow me on Instagram at Dr. Mark Burdorf. You can also follow me at drburdorf.com, and I also have a YouTube channel. It's Dr. Mark Burdorf channel. So hope you're having a great day. Happy Wednesday, everybody.